The three main purposes of the Medical Tourism Association's annual conference in Los Angeles is, one of the biggest ones is educating the buyers, the big insurance companies, employers, and governments, and also medical tourism facilitators who are either currently sending patients overseas or are interested in sending patients overseas, for them to be able to learn on what are their options available overseas, what's the quality like, who are the good players that they should contract with and work with. Some of the other purposes of the conference is addressing some of the key issues that the industry needs to overcome and deal with in order to really grow. Issues such as quality of care, transparency and quality, so that patients, buyers, insurance companies know what is the quality like at certain hospitals and what are the standards of quality that are the minimum that they need in place before they send patients to a hospital or country. And we're also working on addressing issues such as aftercare and continuation of care when patients return home to their home country and not breaking that chain of care. Other issues we're addressing are legal issues, and also just bringing together all the key stakeholders and players in the medical tourism industry so they can work together through a lot of the issues and also network and develop a significant amount of relationships. At our last conference that we had in San Francisco, we had about 850 attendees, and we scheduled about 3,000 private one-on-one networking sessions. In Los Angeles this year, October 26th to the 28th, we're planning on scheduling about 5,000 networking sessions. And I think that's one of the best benefits of the conference, is knowing that no matter where you are in the world, you're traveling to the one conference for the whole world, where you're going to be able to really maximize your time and pre-schedule meetings with important people so you can develop relationships and work on getting contracts signed. And what the conference does in Los Angeles is it allows hospitals to come and governments and network with insurance companies and governments and employers from all around the world. And it involves also the facilitators who are sending patients to come and meet hospitals and governments to send patients to. So it's the one place around the world that everybody gets to meet. And this year at our conference, we're expecting up to 2,000 attendees, about 100 exhibitors and sponsors. We're going to have up to 200 speakers. We're going to have over 20 really cutting edge and exciting workshops so that people can come and learn in 3 days what would otherwise take them 3 years to learn, and to develop relationships that in 3 days would take them several years to learn. And that's, one of the real benefits, I think, is the cost savings and the return on investment from coming to the conference. If a hospital or a government or even insurance company wanted to travel to 10 different countries to meet and network and develop relationships, they could spend $50,000 or $100,000. So the cost to spend for a couple $1,000s to come to one place and meet everybody at once is invaluable. We chose Los Angeles as the main location for this conference for a couple of reasons. One of the reasons is there's a significant number of healthcare buyers within Los Angeles and California. Los Angeles has one of the largest associations of healthcare buyers in the United States. So this plays a perfect partnership with our conference, because we're actually partnering with the association made up of those healthcare buyers. There's also a tremendous amount of employers in California. The California government is a huge target for medical tourism. There's a tremendous amount of different cultures and ethnicities working within the California government, and the California government is at the stage of bankruptcy. So medical tourism is a huge opportunity, and we're going to be inviting a lot of the different governmental agencies within California. Also, Los Angeles is a huge hub for the United States for business and travel. So it's very easy and very inexpensive for U.S. insurance companies and employers to come in. Also for international buyers, it's very easy for Asia, and there's a lot of also tourism options for people who come who want to bring their families. There's Disney World, Universal Studios, and one thing that a lot of people love is that Beverly Hills is a 5-minute cab ride where people can go on the famous Rodeo Drive where all the movie stars shop and walk around. The Medical Tourism Association's network is very comprehensive. Besides our offices in 8 countries, we work with hospitals, governments, and insurance companies in over 60 different countries. And that network is very comprehensive. And we reach out not just to them, but to those people who do business with those insurance companies, governments, and hospitals. So at this conference, we're really bringing in this large network that's going to represent possibly up to 100 different countries. And so the networking opportunities opportunities are absolutely amazing. But one of the things we really encourage and accomplish at our conference that everybody really commented on last year is there's a tremendous ideology at the conference of everybody working together. So this is one of the few conferences I think that I've ever been to where people are eager to meet people. They're eager to share ideas, build new relationships. And that's one of the best benefits of coming to this conference. The Medical Tourism Association, the MTA, we work with all the different ministries, from ministries of tourism to ministries of health to economic development, because medical tourism has a significant impact on all these different sectors within the government. This year at our annual conference in Los Angeles, we really put a huge focus on bringing in the absolute best expert speakers. We had some absolutely amazing speakers last year in San Francisco, from insurance companies and employers like Procter & Gamble and Black & Decker, Cigna, Assurant Health, other large insurance carriers. We also had the person who's now chairman of the board for the American Medical Association speaking in the American Dental Association. So as hard as it's to believe, I think we're going to have even more amazing speakers this year. We're bringing in a lot of the ministries of health that are sending patients overseas from the Middle East, from North Africa. We're bringing in even more insurance companies who are going to be speaking, not just from the United States, but all over the world, from Latin America and the Middle East, talking about how medical tourism is being incorporated into their health insurance plans in their countries. And we're also working very hard on bringing employers in as speakers that are international employers who have employees in all different kinds of countries. So on top of the speakers, one of the other exciting things we're doing is we're dedicating a couple employees that are just focusing on really working on bringing in employers and insurance companies and ministries of health as attendees to meet our Medical Tourism Association members, to meet the attendees of the conference, the exhibitors, because it's very important. In medical tourism today, a lot of the governments and insurance companies and even the facilitators who are sending patients overseas, they don't know what are the best hospitals, what are the best countries to send patients to. If an insurance company today is just getting into medical tourism, or an employer, they don't know what those destinations are. So that's what our conference is doing, is we're helping educate them. These are the countries, these are the hospitals, these are the players you need to meet with and develop relationships with. There are a lot of different benefits for the different types of attendees who are coming to the conference. I think one of the different types of attendees that gets the most benefit actually is the exhibitors, the ones who have an exhibit booth. And the reason why that is because that we situate our conference so there's constant flow through the exhibit hall. When there's such a large amount of people, it's very difficult to try to pick out the people you want to meet with where everyone flows through the exhibit hall. The exhibitors last year at our conference commented on they couldn't believe how many people were there, and that they actually had to man their booth for 8 to 9 hours at a time per day, and didn't get any break to attend the sessions because people were constantly at their booth. Some of them commented they had contracts signed right at their booth. They had amazing networking opportunities. So the exhibitors have an absolute great time. For the normal attendee that just wants to gather information, they're going to get a tremendous amount of information. They're going to find out what are the best destinations for medical tourism, what's the quality like, what all about accreditation, international patient services, the whole process, aftercare, legal issues. So they're also going to be able to meet the hospitals, the countries, the facilitators, everybody involved in the process. So they're going to walk away with business cards of everybody they need to immediately implement medical tourism. The other side of it would be governments or healthcare clusters that are interested on building clusters or building medical tourism and bringing patients into their country. What they're going to learn is they're going to find out what is every other country doing out there, what are other healthcare cities and medical clusters doing, what works, what doesn't, why is it successful, and they're also going to build relationships to bring buyers in, to create FAM or familiarization trips, and start bringing companies in that could start sending patients and put them on the map for medical tourism.